Hello, fellow optometrists. I hope you are doing well and are safe and looking forward to future face-to-face meetings. I would like to thank the president of FedOpto, Laura Gordo, for inviting me to participate in your celebration of World Sight Day 2021. Let me start by telling you a little bit about my background. First, my name is Dr. Sandra Block. I go by Sandy to my friends, which I hope includes all of you. I was a pediatric faculty member at the Illinois College of Optometry for 39 years, with the last 9 years of my career overseeing a school-based vision clinic that served children from low-income areas in the Chicago public school system. Over the past year and a half, as we all know so well, our lives have changed in response to COVID-19. The impact of the pandemic on teaching and clinical practice helped me to decide to move away from my career in teaching in optometry school in the US to shift my focus on issues related to the profession of optometry at a much more global level. I have had the opportunity to work with a number of international organizations on various tasks and committees, but they all really focus in on public health issues in eye care. Working with these non-profit organizations has filled my time and really excited me about what we can do as optometrists in the world. Currently, I sit as the chair of the Public Health Committee for the World Council of Optometry, and I look forward to continuing my dedication to the World Council of Optometry as my term as chair of the Public Health Committee ends in November. In addition to being a faculty member and working on these NGOs, I've had the opportunity to serve people with intellectual disability, actually since my graduation. So I first started to focus on people with disabilities in my residency, where I focused on children with multiple handicaps. And then I followed that up by working as a global clinical advisor for the Special Olympics Lions Club's International Opening Eyes program. My passion for working with people who are unable to advocate for themselves is a driver for me to continue my work in optometry and public health. Now, as I just said, I listed them separately, optometry and public health, but the reality is they are truly intertwined. And when I think of optometry, I think of public health together. So that being said, I want to say it's truly an honor to be able to be here and speak with you, albeit virtually, on World Sight Day. World Sight Day is an integral program from the International Agency for the Prevention of Blindness. I have to say, I was really excited when the International Agency for the Prevention of Blindness, or IAPB as they're commonly referred, came up with this year's program and the tagline, "Love Your Eyes." That says it all. It's simple, it's clear, and it's a direct message that the world can easily understand. In addition to celebrating the importance of focusing on vision and eye health issues for that one celebratory day, we have been asked to commit 1 million sight tests during the 100 days preceding the actual World Sight Day. So hopefully you are all part of that, because that really means that optometry is contributing to making sure that services are delivered to the population worldwide. Based on who we are, that is optometrists dedicated to promote good eye health, prevent visual impairment and blindness by providing the highest quality of care you can to your patients, staying abreast of the evidence to ensure that we continue to deliver the best eye care possible for our patients, and to be able to ensure that that care is equitable, accessible, and affordable for everyone. Optometry is really ready to respond to this call to action. Many of you have heard of, or hopefully have read, the 2019 World Health Organization's, or WHO's, first World Report on Vision, or at least the executive summary of that report. And you probably recognize some of the terms I've just used because they're very commonly found in that document. The World Report on Vision is a roadmap and a guide to ensure optometry's placed in the continuum of eye care is maintained for the next decade and far into the future. The World Report on Vision focused on the most common causes of preventable vision impairment, specifically refractive errors and cataracts. The report highlighted that there are 2.6 billion people worldwide with preventable causes of visual impairment and blindness. And of those 2.6 billion, 1 billion has yet to have been addressed, or simply saying they've either not seen an eye care provider or not received the appropriate intervention. In addition to refractive error and cataracts, the World Report on Vision highlights other things. And one of the ones I really want to focus in on is the work that the late Brian Holden published, which states, if you look back at the manuscript that was published, that myopia is increasing at an exponential rate, and we need to address it. The World Report on Vision discusses the data that highlights the importance of being corrected for other types of refractive error, specifically presbyopia. What they talk about in that report is there is a study that looked at workers who were corrected with the appropriate presbyopic correction and those that were not, and found those who were corrected produced more or worked at a higher level of output compared to the control group. So thus, that being said, that correcting for presbyopia is basic to ensuring quality of life and success in vocations would be due to an intervention for presbyopia. The World Report on Vision also targeted the importance of integrating eye care into the country's healthcare system. What a novel idea, having universal healthcare, which would say all healthcare providers included eye care as to the things that are delivered to the patients in that country. Let's use an example of something that I think is really very common in practice. We know that non-communicable diseases such as diabetes, prior to the pandemic, we saw those numbers were increasing, and significantly so. As we look back at the past year and a half, we would have expected during the pandemic that the numbers were increasing even faster due to a number of factors. Number one, we saw people were not attending gyms and not taking care of their physical health as much. Even more related to the physical movement is the fact that we weren't traveling outside our homes. We were pretty much locked down for a majority of that time, other than if you were going to work because you were one of the essential workers. We also know that there were potentially poor diet choices for two possible reasons. Number one, because access to healthy food wasn't there. For example, in the Chicago Public Schools, which I worked, we used to ensure that children had breakfast and lunch when they came to school, but the access to those healthy meals was no longer possible once the school closed down. But there's also the choice that people were making poor choices in what they ate. And lastly, there was a reduced access to regular health care. So people were not following up with their physicians for things that they didn't think were as important, which they thought was more, yes, I should go, but I don't necessarily have to go because there's no acute condition pushing me to go see my doctor. So because of all those reasons, we suspect that there are higher rates of uncontrolled and possibly undiagnosed type 2 diabetes that occurred during the pandemic. Now, we all are aware of the issue that if you have uncontrolled diabetes, the likelihood of a higher risk for undiagnosed diabetic retinopathy will follow. I expect that the numbers of people with previously undiagnosed diabetes and diabetic retinopathy over the next 6 to 9 months is going to increase as well, as we see our patients starting to reach out for the regular health care that was missed during the pandemic. Under the model of universal health care, in patients with diabetes, there's going to be a different level of communication with us as optometrists. The expectation under universal healthcare is that all healthcare providers would communicate with their patients and their families, as well as communicate with other healthcare providers to ensure that all of their patients are getting adequate care and that every provider knows what the other providers are doing. We also need to ensure that this is focused on the individual, what is considered integrated patient-centered care. So if I was seeing a patient in my practice and I knew that they were diabetic, I would say, have you seen your dentist? Have you seen your physician? Have you seen your podiatrist? Just to make sure all of the care that that patient needs should be included in the discussion when I send them on their way. Optometry needs to be more involved in this kind of a process. Then the next question I asked is, where do we as optometry fall in the bigger picture? I want to say right up front, the World Report on Vision was written highlighting the need for optometry to take a very active role in working to control and reduce the most common causes of vision impairment and blindness. And actually, even those vision problems that create discomfort or interfere with daily life, but not necessarily causing visual impairment and blindness. We need to be right there. We need to address those dry eyes, the conjunctivitis, the things that our patients have been experiencing over the past. Our profession has always been the best provider for refractive errors, though. So let's move into that arena for a moment. We as a profession have embraced opportunities to serve communities of need and those with less ability to access care, whether it's because of mobility or financial ability or understanding. We have always stepped up to the plate. As I mentioned before, I am part of the Opening Eyes program. This is a global program that's focused on Special Olympic International. We engage all types of eye care providers, but in my experience over the past 20 years, I have found that optometry has always been front and center in volunteering to serve patients with intellectual abilities in our program. And remember, the whole process of exposing people to this population is to give them a sense of comfort and open the doors of their practice to serve these people in the years ahead. Clinical optometric practice has really grown with widening scope over the past several decades. You know, we've gone from simply treating contact lenses to much more global perspective of what our patients need. So that scope of practice has widened. Yet we as optometrists have maintained our skills in dealing with quality refractive errors. Earlier this year, the World Council of Optometry released a resolution that focused on myopia. Myopia, as we all know, is one of the most common causes of refractive error. And over the decade, I'm sure everybody is aware of this, that there have been a number of very well-designed research projects or studies that highlighted the impact of myopia on eye health. The evidence has shown that we as optometry must shift our view of addressing myopia simply as a refractive error to treating it as not only a refractive error, but also something that could lead to complex diseases that we know can be prevented, can be accurately diagnosed and appropriately treated as an eye health disorder. We know the research has identified the specific eye health problems that we would expect to follow in our patients with moderate to high myopia. That would include cataracts, retinal detachment, myopic maculopathy, glaucoma, and optic neuropathy. Each of these diagnoses individually puts the eye at risk for vision loss. The research that has been published has demonstrated that there are also other clear risk factors for the development of myopia that we need to be aware of, and have even identified some lifestyle activities that have been shown to prevent or slow the progression in the development of myopia. We as optometrists can start to highlight the identification of these risk factors as early as in the beginning of our case history. As we talk to the patient, we can understand where they stand with the potential for developing the risk of myopia. The release of the World Council of Optometry's resolution on myopia is basically a call for optometry worldwide to stay current with the research that is related to the impending myopia pandemic and prevent it from myopia from progressing and developing significant visual impairment and blindness. So knowing that there is a potential of developing myopia is not sufficient to affect change. We need to look at the studies that have identified how to intervene and slow that progression. What treatments are out there that we can use in our practices that are the most effective? Well, the good news is there are a number of studies that have identified several interventions that are successful in slowing the progression down. Some of those include specific types of spectacle lenses, specific types of contact lenses, orthokeratology, as well as pharmaceutical interventions. We can integrate these interventions to slow or prevent the progression of myopia in our practices, and we should. It is our responsibility. And these are things that are core to optometric practice. We need to understand what questions to ask of our patients. We need to educate our patients and the parents of our patients about these options and knowing what options that would fit that patient the best. And we need to deliver the most up-to-date care to our patients. We know that's basic to ensure that our patients are receiving the best care possible. And we can do it. In conclusion, I'd like to highlight the fact that optometry is in an excellent position to be central to work to reduce the number of people globally who have not been seen and reduce the magnitude of vision impairment and blindness by continuing to provide the highest level care that our licenses allow and ensure that the scope of practice for optometry continues to follow the science. It's extremely important for us as a profession to continue to educate ourselves with the new high quality research as it is released. We need to embrace scientific progress to ensure that our scope of practice reflects optimum care for our patients. So with that, I'd like to say thank you for listening and best wishes for a successful World Sight Day, and continue to love your eyes.